Hello, this is Bernard Ziegler. Talk about the extra clinical care coordination offered by the Pathways Community Hub model. This is a continuation from the previous discussion in which we considered formalizing Porter's integrated practice unit with system of systems modeling and simulation. To overview, we'll reconsider the healthcare reform problem as a systems problem and develop a healthcare system model, and in particular the integrated care system model we discussed earlier. However, this time we'll focus on the Pathways Community Hub to provide extra clinical or outside the clinic care coordination. We'll discuss its approach to accountability and pay for performance, and how the hub can coordinate care agencies to eliminate duplication. Finally, we'll consider the health information technology that can support the Pathways Community Hub data infrastructure. Reviewing our discussion of the healthcare reform as a systems problem, recall that major aspects of care are in need of coordination: the clinical and extra-clinical. Clinical care refers to medical observation and treatment of patients preferred by physicians, hospitals, labs, etc. The coordination is required here because the various specialists involved in collaborative treatments are too loosely coupled to provide the best care at the lowest cost. Extraclinical care coordination is the organization of care activities among the individual patient and providers involved in the patient's care to facilitate appropriate delivery of healthcare services. This care requires coordination of services to help patients deal with multiple tasks and decisions before and after their in-hospital treatment, where almost all decisions are made by doctors and nurses. When the patient leaves the hospital, all decisions are more or less up to the patient, and extra clinical care coordination is required. In the healthcare system model we imagine, the patient with medical problem is managed by the healthcare system and interacts with it, and eventually emerges, hopefully, with an improved condition. The healthcare system is broken down into two domains: the clinical domain and the extraclinical domain. Both are in need of coordination and integration, and in particular, in this talk we'll focus on the extraclinical domain. The integrated care system model, we deal with both the clinical domain and extraclinical domain. For the clinical domain, we talked about the integrated practice unit. For the extraclinical domain, we'll talk about the Pathways Community Hub model. It has a hub that coordinates care agencies, and the care agencies have care coordinators that deal with patients and clients, and they provide the coordination services that are needed, as we said, in the extraclinical or outside the clinical domain. And in particular, they help the patient deal with the multiple decisions and tasks that they require to carry out as part of an essential part of their treatment. The Pathways Community Hub model is a delivery system for care coordination services provided in a community setting. At the foundation of the model are core pathways, the hub itself, and payments linked to outcomes. Monitoring of pathways enables tracking of individual patient progress and coordinator pay based on end-to-end outcomes. Community care coordination is needed to eliminate duplicative services and focus in on meaningful outcomes. The current system is fragmented and focused on activities, not outcomes. High utilizers of the healthcare system often have complex needs outside the scope of traditional medical providers. Social determinants such as housing, job assistance, etc., act as barriers to successful treatment of the medical conditions presented to physicians. For a brief overview of the pathways, consider the pregnancy pathway. In the database collected on patients' progress through the pregnancy pathway, there are steps kept track of, which are numbered pregnancy 1 to pregnancy 6. Pregnancy 1 has to do with pregnancy initiation. Pregnancy 2, the first prenatal appointment date. Pregnancy 3 has to do with appointments and can be repeated several appointments. And for pregnancy 4, 5, and 6 concern delivery. Pregnancy 4 for normal. Pregnancy 5 for low birth weight. And pregnancy 6 where there was incomplete information and the pregnancy pathway terminated before a result was known. This is modeled in a discrete event form by a set of states that are connected through transitions. For example, starting in pregnancy 1, when that occurs, a date is entered and the system waits for another entry, which would be pregnancy 2. Pregnancy 2, another entry, leads to pregnancy 3. And finally, after several iterations of pregnancy 3 for the different appointments, we enter pregnancy 4, 5, or 6, depending on the result. Let's consider pathways accountability and pay for performance. General strategy is to identify the workflow necessary to achieve a particular outcome and/or immediate outcomes. And then incentivize both the outcome and the processes that lead directly to that outcome. Pathways specify tests for accomplishment of such outcomes and time bounds within which such tests must be satisfied. Pathways are therefore structures like skeletons, showing goals, sub-goals, and connecting paths, such as the pregnancy pathway that we saw just before. Care coordinators, for example, community health workers, and their clients or patients, are accountable for achievements of the goals and sub-goals. Unlike clinical pathways, coordinated care pathways are focused on measuring accomplishment of goals, leaving the details of the necessary steps to the CHWs and the clients. For example, clients must schedule and keep appointments with the doctor throughout the process in order to make progress and be recorded as having made such progress in the pathway. Having discussed pathways, let's consider the need for community hub coordination of agencies. Communities without agency-level coordination, duplication and effort arises among services financed by different funding streams, health plans, state health departments, mental health programs, so on. Almost every funding stream pays for some care coordination services. And individuals can have several agency-employed care coordinators. Such care coordinators may know very little about the services that others are providing. The hub enforces registration of coordinators serving clients so that a client ideally is served only by a particular single coordinator, not possibly many coordinators for the same service, because the hub is registered and knows which coordinators serve which clients. This assures the uniqueness of allocation and eliminates duplication. And payers like to deal with hubs for this purpose, rather than dealing with multiple agencies, each of which may be performing the same service but without a standardized pathway description and without coordination provided by the hub. Finally, let's take a quick look at how health information technology can support Pathways Community Hub in supplying a multifunctional data infrastructure to carry out the community-based coordination. The community health worker or care coordinator can interact with Pathways web services to monitor a client in the progress through Pathways. A particular client may have several pathways being undertaken at the same time, and there may of course be multiple clients in the system, all being tracked with particular care coordinators doing the tracking. A care coordinator can request data at a particular pathway step, and the Pathways web services can go to the supporting electronic health record database to get that data and to support the ability for the coordinator to check on where the client is supposed to be and interact with the client and then provide data according to whether the client has carried out that step or not. This tracking therefore is supported by pathway models such as we've seen that can keep track of different states in which the pathway is and the expected responses and expected inputs that can arise in that state. The structure itself then can be used for not only patient monitoring but also cost accumulation as patients and coordinators move through the pathways. And these data can be aggregated to supply analytics for assessment of how well coordinators are performing and for how well clients are adhering to their roles and their required activities in self-management. Analytics can also be developed for the overall hub operation. Such elements as interactions with payers and interactions among agencies and so on can be monitored and eventually improved for overall performance quality and cost reduction. Conclusions. Pathway Community Hub provides extra clinical coordination in an integrated care system. Pathways are a measurement tool for tracking care coordination, patient adherence, with accountability and pay performance. Pathways Community Hub provides coordination of agencies to eliminate duplication and focus on outcomes. Pathways Community Hub data infrastructure can provide services to multiple users, clients, coordinators, supervisors, agencies, operations managers, etc. Thank you.